Feels like the OET Medicine is an alien exam while you're focused on the USMLEs, right? Well, here's the catch. The ECFMG requires it for certification. Let's break it down so you can ace it smoothly. Plus, I'll be sharing my grades at the end, so stick around. So what exactly are you facing in the OET Medicine? Well, get ready to master the pronunciation of sciatica, the spelling of ampule, saying benign paroxysmal positional vertigo without breaking a sweat, and having the focus of an eagle to swiftly read through the content. It's all a part of the journey to certification. Alright, let's break it down so you can ace the OET Medicine in less than a month or even a few days. Yes, it's possible. The test has 4 sections: listening, reading, speaking, and writing. But first, let's talk about numbers. Here's the magic number for ECFMG certification pathway eligibility. These are the scores you need to pass the OET. Now here's the important part. You need to get a minimum score of 350 on listening, reading, and speaking, and at least 300 on writing in one test. If you miss the mark on any section, you'll need to retake all 4 subtests and hit those scores in a single test. The good news? There's no limit on how many times you can retake the test as long as there's scheduling availability. But don't panic. This isn't like the USMLE. Just be prepared and you'll be fine. Let's talk about the test structure, and I'll share my 2 cents on how to prepare for each section. It's a 2-hour and 45 minutes long exam, excluding the speaking section. The OET has 4 sections: listening, reading, writing, and speaking. You'll need to tackle each one with a clear strategy and a dash of confidence to score big. Let's start with the listening section. You've got 40 minutes and 42 questions in total, with 1 mark for each question. It's divided into 3 parts: A, B, and C. Let me break each part down for you. Part A, you'll hear 2 consultation or appointment extracts, and you'll need to fill in the blanks. There are 24 questions here, and they'll test your ability to catch the key information in a patient interaction. Part B, you'll listen to 6 workplace extracts, each lasting 1 minute, and then answer 6 multiple choice questions. This part is all about understanding workplace scenarios, so listen closely for the details. Part C, you'll hear 2 longer extracts, each with 6 questions, and you'll need to answer 12 multiple choice questions in total. These will test your ability to infer meaning from more complex, longer dialogues. Quick recap: 40 minutes, 42 questions, 3 parts, focus on the details, but also practice your note-taking to stay sharp. Aim to get 30 questions right or more out of 42 here to hit that 350 score or grade B. So how did I master this section? It's all about practice. Honestly, even just doing a few sample tests is sufficient. It's not overly challenging once you get the hang of it. Let's start with the reading section. You've got 60 minutes and 42 questions in total, with 1 mark for each question. It's divided into 3 parts: A, B, and C. Here's the breakdown. Part A. You've got 50 minutes to match and complete 20 blanks after reading or short healthcare texts. This part can be a bit tricky, so prioritize which questions to solve first. Part B, you'll hear 6 workplace extracts, then answer 6 multiple choice questions. 10 minutes is a good target here. Don't rush because you'll have 45 minutes in total for Part B and C together, but keep an eye on the clock. Part C, you'll read 2 longer extracts, each with 8 questions. You'll need to answer 16 questions in total. The remaining 35 minutes should be focused here to manage the length and complexity of these passages. Quick tip: time yourself while practicing. I recommend reading as many extracts as you can, and by using a timer, you'll get a better feel for pacing yourself. For Part A, use the right strategy. Focus on prioritizing question types so you don't waste time on ones that might be harder. Again, aim to get 30 questions right or more out of 42 to hit that 350 score or grade B. In the writing section, you'll be writing a letter, usually a referral letter, but it could also be a transfer, discharge, or a letter responding to a complaint. You get 5 minutes to read the case notes and related documents, then 40 minutes to write. Stick to the case notes, keep it clear, concise, and professional. Here's how to approach the writing section. During the first 5 minutes, don't write anything on the notes. Just capture the relevant details you need for the letter's style. Then start by writing the doctor's name and address at the top left of your answer sheet, followed by the date and salutation. Next, jot down name of patient and their date of birth as shown in the case notes, followed by the body of the letter. For signing off, use "should there be any queries, please do not hesitate to contact me. Yours sincerely, Dr." don't write your own name. The word limit is between 180 to 200 words, and the letter should ideally have 4 paragraphs or cover less than a page, including introduction, previous history or admission, current status, your request in view of the above. Remember, this section is subjectively marked, so stay relevant to score the maximum points. Now, a smart way to tackle this would be to read a sample answer letter from the official OET website and use it as a template. This will give you a structure you can follow. Simply insert your own information, modify it as needed, and you'll have the perfectly written letter that fits the requirements. Alright, let's talk about the speaking section. You'll get 20 minutes and 2 role plays. First, a quick warm-up chat with the interlocutor, and then 3 minutes to read the role play card. For each role play, you've got 5 minutes to cover the task points. Both you and the interlocutor have the same background info, so keep the conversation flowing and stay on track. Pro tip: you can underline or add notes to your card to give yourself a visual trigger for what to discuss. It'll help you stay organized and cover everything you need. Now, there's also a linguistic and clinical communication criterion. I've put the link to these in the description box. You'll be scored on how clearly you speak, your ability to explain things to the patient, and your professional tone. Practice role-play cards with someone on alternate days to build these skills. Focus on useful phrases like how to introduce yourself, ask for clarification, or confirming understanding. Basically, keep the conversation smooth and show that you're actively listening. Scoring can vary, with some candidates reporting higher scores than they expected, so don't beat yourself up over small mistakes. Talking about mistakes, some common mistakes to avoid include absent-mindedness or lack of sleep while listening, spending too much time on tough reading questions, misinterpreting case notes in writing and making long sentences, speaking too quickly, or not engaging with the patient in the speaking section. Now, one common question is, should I take the paper or the computer test? Honestly, it's all about what suits you best. Personally, I took the paper test because the test center was super accessible and I didn't have to wait long for the speaking section either. Go with what feels most comfortable and lets you perform at your best, but do practice with the right tools before diving in. Now, what did I do? Start by gauging your baseline with the practice test to familiarize yourself with the format. That's the most important thing to do. Then assess how much you need to work on improving your English skills. Next, create a schedule. I personally dedicated 2 to 3 hours to doing 2 sections, either listening and reading or speaking and writing, on alternate days to balance time. I also took practice tests online to time myself and track my progress. I've already shared my tips for each section and how I approach them individually. Moving on to the resources, the best in my opinion are the OET practice tests. I'll drop a link in the description. Also, check out YouTube videos from OET Official and E2 to tackle any tricky areas. But don't drown yourself in resources. Focus on what you're struggling with and give yourself time to really nail it. So, can you take another English test like the IELTS? Sure, but remember, the ECFMG specifically requires the OET Medicine for certification. As for the cost, the OET typically runs around $587 Australian dollars, but it can vary with the type of test and the location. Check the latest on the official site for exact prices. Alright, drumroll please. My scores on the first attempt: A in listening, reading, and speaking, and a B in writing. Not bad, right? Proof that with the right prep, you can totally crush this. From Alien to Ace, tackle the OET Medicine and earn that ECFMG certification in style. Don't forget to like, share, hit subscribe, and stay tuned for more.